The use of psychedelic medicines began during native and indigenous ceremonies throughout the world. Plant medicine has been used for healing for thousands of years and is still being used today by these cultures. There are many people that continue to suffer from severe mental health symptoms despite medication treatment and talk therapy. These psychedelic medicines are being researched today for the treatment of those who continue to suffer from ongoing debilitating symptoms. The word psychedelic means mind manifesting. People have used these medicines and often describe mystical experiences such as a feeling of unity and sacredness that is difficult to put into words, with an awareness of beauty and love. It can help create more insight and a different perspective of personal life experiences and help make connections with profound meaning. These feelings can also result in gratitude, self-worth, and empowerment. I am an addiction medicine psychiatrist, therefore, of course, initially I had concerns that there would be a rise in psychedelic medicine treatment causing an increase in the potential for more substance abuse. But fortunately, it has been determined that hallucinogens are the least prone to long-term use and have very little addictive properties. It is the lowest category of abuse substances in the United States. Ketamine is considered one of the psychedelics and is often used in medical procedures today. It is FDA approved for pain and is used for anesthesia and sedation during surgery, as well as medical procedures. There have been ketamine studies for depression since the 1990s and is also being researched for a variety of mental health disorders, including major depressive disorder, bipolar disorder, postpartum depression, post-traumatic stress disorder, obsessive-compulsive disorder, alcohol and substance use disorders, and for end-of-life issues. It is specifically useful for people who feel stuck without progress made in their lives. There have been many positive outcomes with the results of the ketamine research for the treatment of depression as well as for anxiety. There are potential side effects of ketamine, such as dissociation, which means that you feel like you're out of your body. Interestingly, it seems as if the people who experience this are the ones that have a very good response from the treatment of depression. There can also be drowsiness, elevation in blood pressure, nausea and vomiting, dizziness, unsteadiness when walking, and blurred vision. The majority of these symptoms are only experienced during the actual treatment, and usually they resolve within about 4 hours after the treatment. Treatment providers will perform a psychiatric evaluation to determine if you or your loved one is an appropriate candidate for this type of treatment. A physical examination, medical history, as well as blood work is also needed. Candidates typically complete a questionnaire about symptoms of depression and anxiety as well. Although ketamine is not currently FDA approved specifically for depression, it is likely to be so in the near future. There is also a sister drug called S-ketamine. The brand name for it is Spravato, and this medication has been FDA approved since 2019. It is in the form of a nasal spray and must be only taken directly under the supervision of your treatment provider. The person undergoing the treatment is directly monitored in the office for a minimum of 2 hours or until the medication effects subside. Blood pressure is checked prior to, during, receiving the treatment, in the middle of treatment, and at the end of treatment. Transportation must be arranged because the person undergoing the treatment may be unable to drive home due to some residual effects of the medications. Another psychedelic is psilocybin, which is a substance that is found in certain mushrooms. There are some potential side effects of psilocybin as well, such as feeling out of body, feeling like things aren't real in your surroundings, some visual changes, possibly hallucinations or paranoia, some confusion, lack of coordination, and possible nausea and vomiting. Studies show that it has benefits for severe depression, anxiety, OCD, PTSD, alcohol and substance disorders, and end-of-life issues. I do want to mention microdosing, which is often a topic in social media. Microdosing is the use of very low doses of psilocybin for a consecutive number of days and then holding the substance for a number of days with on and off cycles. It should be noted that there are no specific medical protocols for microdosing, and it is not considered a typical psilocybin treatment. More studies are needed to be performed in order to know the safety and the benefits of this type of treatment. I have concern about the lack of supervision by a medical or mental health care provider. A therapist is also needed to help to integrate the thoughts and feelings about the experience. Another psychedelic studied is MDMA, which is sometimes known as Molly or ecstasy. It is considered an empathogen, meaning that it helps to express emotions and love. Just like other psychedelics, it works on the chemicals in the brain in a similar way to antidepressant medication, but it has some differences. It reduces fear, it decreases fearful memories, and it helps improve plasticity of the brain. There have been many positive outcomes in research studies, especially for post-traumatic stress disorder. There are some side effects that can be experienced by MDMA, including muscle tightness, decreased appetite, nausea, vomiting, restlessness, dizziness, temporary elevation in blood pressure, restlessness, non-heart related chest pain, dry mouth, and blurred vision. The experience the person has with all psychedelics depends on the mindset, the attitude, belief, and the intention of the use of the psychedelic medicine. Also, the setting is very important. Psychedelic medicines are intended to be taken directly under supervision of your treatment provider for safety and support. Psychotherapy or talk therapy is an integral part of the psychedelic treatment. Psychedelic treatment, as you can predict already, it is very unique. It holds the philosophy that the person's body has its own innate healing intelligence. During the dosing experience, the person is lying down, wearing eye shades and headphones while being guided to go inward. Music is played through the headphones and is also an integral part of the experience to enhance the treatment. The provider or therapist is present throughout the duration of the dosing experience. That is, it can be at least 2 hours for a ketamine session and up to 6 to 8 hours for each psilocybin or MDMA session. The therapist provides active listening, holding space, ensures safety, and provides reassurance. Sometimes 2 therapists may be present during a long session. It is true, the dosing experience can feel like a magic carpet ride. It can make you feel like you are floating out of body, and especially with ketamine, the experience is sometimes described as feeling like a car wash for the brain. The therapist will speak very little during a dosing experience to allow the person to use their own words to describe the experience and to make their own connections and meanings. Even what may be perceived as a negative experience is encouraged and should be approached with curiosity. After the dosing session, the clients may have a number of psychotherapy sessions to help to integrate the experience and to make connections to their daily lives. In between sessions, the person is encouraged to have a healthy diet, incorporate exercise such as walking or yoga, spending time in nature, journaling, and creating artwork about the experience. So as I have stated, there have been some incredibly positive results, which is exciting with the current studies regarding ketamine, psilocybin, and MDMA for a number of mental health disorders. It is anticipated that these substances will be obtaining approval by the Food and Drug Administration within the next couple of years, if not sooner. For treatment providers, as well as those seeking treatment, I encourage everyone to keep an open, curious, beginner's mind for these new treatments that can greatly benefit many people who are currently suffering despite persistent traditional mental health treatment. I'm Dr. Leslie Madrak. Thank you for watching. Take care.